I want to talk about antibiotics, gut health, gut dysbiosis, probiotics, and specific antibiotics. It's a common topic I have with pet owners when we're talking about using antibiotics. Because I have seen commonly that antibiotics maybe are relied upon a little too conveniently to make us feel, us as veterinarians, that we are doing something for you, the pet owners, and to make it feel like we're doing something for the pets. And so I want to talk about, yes, there is sometimes a need for them, but also to think more forward and not just in the now, what we are doing for the pet's health. If we haven't had a chance to meet, this is the first episode you're listening to, this is the first episode you're watching. I'm Dr. Bamonte. I'm a veterinarian of over 11 years, and I really embrace taking an integrative approach. So I take what is great about conventional traditional medicine, and then I take what is great about holistic, and I combine it for this integrative approach. And so let's talk about some antibiotics today. Let's talk about the gut health. Let's talk about dysbiosis. And I'm going to refer to my notes because there are some really good takeaways that I want you to know about and that you can put into action. So antibiotics are important. They can save lives. There are times when we absolutely need them. Antifungals, antibiotics, there's absolutely a time. And I think this is where we become responsible as veterinarians, medical professionals, and you as a pet owner have responsibility too, to not always maybe be leaning on them, to not always be asking, to be open-minded on, hey, there are other ways that we can help support your dog and while they're having a cough. There's other ways we can support your pet while they're having diarrhea, rather than let's just go to another course of antibiotics, because they're great in the moment, but what we don't think about is the forward and what they're doing. And so they are great. They can save lives. They can improve the quality of life, but they come with a cost. And so we need to be talking about that. And I think you as a pet owner deserve to know this so that you can feel comfortable and have these conversations with your veterinary team to either know, yes, this is needed and I know what potentially can happen and I'm going to be proactive about it, or you know what? I'm okay trying other ways to help support my pet during this issue. And I know that we can use those if we need them, a tool in the toolbox. And so when it comes to your pet's gut health, the thing is that it's not going to show up immediately. It is likely going to sneak up on you months and months and months later. Allergies, anxiety, yeast infections, poop issues, skin issues, ear issues, anal gland issues. That's when it shows up, and that's how it can show up. And it can be sometimes very confused on, is this an allergy? Is this gut health? Is it both? And so antibiotics are not bad. I do think they're overused. And why I say this, in fact, I was just talking about this last week. I've been a relief travel veterinarian for 5 years now. I've practiced in 4 different states. I have been in over 75 different hospitals all across the country, from low cost to very, very nice boutique. And I have to tell you that I think they're relied upon a little bit too conveniently. It's not like I've been practicing in one hospital and been mentored by one doctor and I had this perspective. I have been in Texas. I've been in Florida. I've been in South Carolina. I've been in Georgia. I've practiced and talked to multiple veterinarians. I've talked to pet owners. I've been in all varieties of cities, small, very, very small towns to big, big cities. And they're just the quick fix. Here, your dog's having diarrhea. Here's some metronidazole. Oh, your dog has a cough. Here's some doxycycline or some clavamox. And we're half the time I see these dogs going home and no talk about probiotics, no talk about gut health. And here's the thing is that some of these antibiotics, one use can alter your pet's gut for the rest of their life. And so I'm not saying don't use them. I'm saying let's be responsible about them. And while we use them, think about the gut in the future. And so we rarely talk about the gut. We rarely talk beyond probiotics. I'd say about 50% of the time I'm seeing pets going home with either any of these antibiotics, any antibiotic, but specifically the ones that we really know wipe out gut bacteria. No one's talking about probiotics. No one's sitting home. Well, I'm not saying probiotics protect everything. It's a little bit of a help. And so let's talk about how to help your dog or cat, but without fear, so that you can feel educated and you can influence their health. And so here's the thing with antibiotics. It's not like they go in and they police and know, oh, you're the bad bacteria, you're the bad bacteria, you're the bad, you go, good stays. It wipes out everything. And so that's the issue, is that it doesn't just target the good, it targets all of it. And we need good bacteria. And I'm going to go over some examples of good bacteria that are wiped out and how it can affect your dog's gut or your cat's gut. And so it can affect digestion, immunity, their immune system, their skin, their ears, the poop, their mucus in their poop, their anal glands, their brain function, their anxiety levels, inflammation. So there's a lot to it. Again, I'm not saying antibiotics are bad. I'm saying for pet owners, and I've had pet owners do this, I just want an antibiotic. I don't want to test. The dog's having diarrhea. I just want this medication. Okay, and sometimes we need it. Also, I want you to be aware of what we're doing every time we rely on those, especially if your dog is someone that has a cough several times a year that may not be infectious or has diarrhea. And so some antibiotics are harsher than others, specifically like metronidazole, clavamox, cephalexin. They can be a little bit harsher on the gut bacteria. And I'm not saying harsher that your dog's gonna have an upset stomach necessarily. I mean harsher in the sense of what it does to the gut microbiome, the community of bacteria. So metronidazole, for example, it rapidly will reduce microbiome diversity. And I've heard drug reps talk about this, drug reps talking about this. So it does target some good bacteria that we want. For example, it does, I know Fusobacterium, which can help with digestion. It does bacteria, oh my goodness, bactero, I'm tongue twisted right now. Bacterio I'm going to come back to it because I'm just tongue twisting myself right now. Essentially, it is a bacteria that is involved in digestion and immune regulation. And this will decrease the butyrate producing bacteria, like certain types of Clostridium. Now, certain types of Clostridium we don't like, but certain Clostridiums we want. Bacteroides. That's what I was trying to say. I was tongue twisting myself. Goodness. And so when these good bacteria are harmed, we can decrease our butyrate. And that butyrate fuels, it's fuel for the colon cells. Colon is a large intestine. That's the poop maker in your dog. And this can help reduce inflammation and can support the gut lining. So when you lose these, it's possible for your dog to have leaky gut, which can affect their skin, their allergies. Clavamox, or also known as augmentin on the human side, it's broad spectrum, and it damages a lactobacillus, a bifidobacterium, and this can decrease GABA-producing bacteria, which can even affect their behavior. There's so much with the gut linked to our pet's behavior that is not talked about. And so clavamox can do this, which can increase the risk of yeast overgrowth as bacterial competition is removed. Hello, yeasty ears, yeasty paws, yeasty skin. And the gut pH can be increased, and that can disrupt nutrient absorption. This is just from clavamox alone. So if your dog's been on clavamox repeatedly, especially if it's like a shot in the dark, these are things we need to think about. Again, I'm not saying that these are bad. I'm saying we need to be mindful of them. So maybe after you've had a round of antibiotics again, it's not always immediate, it can be months and months and months later. Yeasty ears, loose stool, anal gland issues, reactivity, skin flare-ups. Now, could it be related to something else? Absolutely. Could it be related to this? Absolutely. Doxycycline, I see it prescribed all the time for any sort of cough, any sort of upper respiratory signs. That could be allergies, could not even be anything infectious, could not even be anything bacterial. It's an antibiotic, it doesn't do anything viral. Decreases the mucosal protective strains, so the bacteria that help protect the lining of your dog or cat's gut. It decreases that mucus layer protection in the gut so that their gut is more permeable, so more leaky gut. The immune system has to work harder to maintain balance, and there can be mild dysbiosis leading to long-term, again, in the future, immune system dysregulation, dysfunction. Those are 3 commonly used antibiotics. That's not even all antibiotics. Again, I'm going to say it again. I'm not saying that these are the devil. We have to be mindful and be responsible when we're using them and really think, okay, do I think this is in the best interest of my pet? I know what potentially could happen using these, or is this the best interest of my patient? Okay, if so, how am I going to be proactive about this? I know my patient needs these. I know my pet needs this, but not just being blind to, okay, it's fixing this problem and moving on. And so dysbiosis means that there is an imbalance, that the gut is out of whack with the bacteria, that it's too little good and too much bad. We don't want that. We don't want that in anything in life, right? So it can show up as chronic itching, licking their paws, ear infection, poop issues, behavioral issues, inflammation. It can be triggered by multiple rounds, a single round, depending on what type of antibiotic. And then you have other factors that can be contributing to this. Their diet, their stress, their environment absolutely can influence the effects that these antibiotics have on the gut bacteria. Are we already have a poor gut bacteria? Are we constantly stressed? Are we on a processed, highly processed diet? We probably don't have the best gut health then. That just hasn't manifested. And it's just taking something like this to be the drop in the bucket. And so you're probably not going to see these issues immediately either. They're going to show up later. And so signs that your dog can be dealing with gut imbalance for you to look at, think about, and I've mentioned this previously, and I see it time and time again in consults. Chronic ear infections, chronic GI issues, bad gas, anxiety or reactivity with no known trigger, itchy skin or paws, smelly, itchy skin or paws, especially that yeasty Frito smell, anal gland issues, loose stools, mucousy stools, inconsistent stools. So if antibiotics are needed and they're absolutely like, okay, we know we have this infection, we have this urinary tract infection, or we have this upper respiratory infection that we really think it is antibiotics are gonna help, then here's what I would do to minimize the damage. So I would put my pet on a probiotic. I would be mindful when my pet was getting the probiotic. I would space it out 2 to 3 hours away from the antibiotic use. Good news is that probiotics are once a day. You can give it in the middle of the day. If the antibiotic you're giving is once a day, great. You give the antibiotic in the morning, give this at night. Just space them out at least 2 or 3 hours. The probiotic I would be using would be a multi-strain probiotic, not just one strain of bacteria. I would consider using one with Saccharomyces. It's a yeast probiotic that survives antibiotics. I would add in gut-soothing foods or even supplements, bone broth, glutamine, slippery elm, marshmallow root. I would consider putting my pet on those, especially knowing that, and sometimes we don't know our pet's gonna be put on antibiotics, right? It's not like we can plan for the future, but let's say your dog's gonna have a dental and we're thinking that there's gonna be extractions and we're thinking that there's gonna be antibiotics. And you can ask your veterinary team, hey, I see there's extractions on the estimate. Do you think there's gonna be a chance of antibiotics? You can start all this prophylactically and just help get that gut so healthy. If your dog's gonna have surgery and you think your dog's gonna go home with antibiotics, obviously we can't plan for infections, but as much as you can plan, I think it's great. And I would stay on this protocol of this gut soothing, gut health promoting, repairing for at least 2 to 4 weeks after the antibiotics, at least. At least. And so after the antibiotics, I think is when most people like stop. And so I will tell you, when I prescribe probiotics, I usually go double the length of antibiotics. And I've started doing any antibiotic that my patients are put on. I'm putting them on a probiotic. So let's say I put a patient on a 7-day course of antibiotics. And I'm like, okay, this dog's got a raging urinary tract infection. Of course, I want to know, why does this dog have a raging urinary tract infection rather than here's antibiotics to move on? Why? Let's recheck, but like, why? Again, did we do something in the immune system previously? And so if I put them on 7 days of antibiotics, I'm probably putting them on at least 2 weeks of probiotics, at least. And so most people kind of stop where the healing starts. So they're like, oh, my dog is better. I'm going to stop this. And so what I would do is I would continue the probiotics, which should also have prebiotics in them to know that they are really beneficial, because the probiotics, though the bacteria needs prebiotics, it's fuel, it's fiber for them. And so that would maybe be like things that you would look for in the ingredients, like chia, psyllium, cooked vegetables, mushrooms, anything that's got prebiotics, so essentially fiber. You can support them through liver detox. The liver is going to detox a lot of the antibiotics. Commonly, a lot of these antibiotics are filtered through the liver and or kidneys. So you can support the liver with milk thistle, silymarin. Those are great ways. You can do some broccoli sprouts. That's also wonderful to do if you're more into the more food side of that. You can rotate in fermented foods like coconut kefir, sauerkraut brine. Just be careful. Some dogs may be a little bit sensitive to it and maybe a little gassy. I would really focus on my pet's diet. If they're on a very ultra processed food, maybe this is the time to take them off of that for a little bit. Now be mindful. I will tell you, a lot of dogs, once they get off ultra processed food and they start eating less processed food, they love it. Whether it is formulated home cooked, whether it is commercial fresh food, whether it is air dried food, dehydrated food, fresh frozen or freeze dried, they tend to like it. And so I would consider putting them on a less processed food. And if the symptoms linger, or all of a sudden your dog's never had an issue, and all of a sudden now your dog is having these issues, and you're thinking back, you're like, you know what, they have been on antibiotics before. I would consider testing their gut. And you can do that. In fact, I recently did it for my dog through Antibiotics. I did their gut microbiome test with his poop. I'm awaiting the results. In fact, by the time this airs, I may have the results, and I definitely am going to be doing a podcast episode on that. It is a great test that you can do. It is very easy. It reports the results to your veterinarian. In fact, just 2 weeks ago, I had a consult with a pet owner who used that test and got wonderful information and was able to have the needed, I would say, probiotics formulated for his dog based on the results. So great test. I'll put the link down below. So if the symptoms linger, stool testing may be warranted. And so there are myths, there are mistakes, there are misconceptions when it comes to antibiotics or even gut health. And so I want you to know about them. So antibiotics are bad. Antibiotics are not bad, and antibiotics are not always the answer. You can look at that from both spectrums. So uninformed use, I think, is not the best. If we're just blindly, well, we don't know what's wrong, let's try it. And I get sometimes where we have to throw a Hail Mary. I absolutely understand it. But if we haven't gotten really dug deep and like peeled back layers on the onion, just got to be mindful. These are things that can happen with antibiotic use. I will see owners say, well, I'm giving yogurt as a probiotic. That's great. I love that you were trying to think outside the box and be more natural options. It's just not therapeutic. Some dogs are sensitive to dairy, and you can't really quantify how much is in that scoop that you're using. And is there prebiotics in it? So there's a lot of factors that tend to have a lot of sugar. So it's not usually my first go-to. A lot of people will stop the probiotics when medications stop, or I'll see owners decline probiotics with antibiotics use because it's unfamiliar to them. And so they think they're going home with something that's unnecessary, when in fact, it is so necessary. And so not going home with them or stopping them abruptly is a mistake I see. And I think also it's a lack of client education. And so that is our job, is to educate and letting pet owners like you know the importance of the gut health and protecting it. And so also sometimes using the same probiotic long-term with no rotation. It's great to rotate strains. It is great to rotate forms. It is sometimes even good to rotate brands. There's going to be different CFUs, colony forming units in it. So I think it's good to rotate the probiotics, the type, the brand, the strains in it. That's going to give even more diversity, which is what we want for the gut. So you can't control everything when it comes to your dog's health and their body and how it works, but you can be really proactive before, during, and after antibiotics. Especially, I know sometimes we don't always know the before, right? We don't always, but we definitely know the during and the after. And so there's so much value and so much importance in that time frame. It's not just always before. So don't fear medicine. Don't fear antibiotics. But don't give them blindly. Don't accept them blindly. Don't request them blindly. I see that a lot with pet owners, is that again, I've had this happens a lot, where they come in and they don't want to do any testing, and they just want the metronidazole again. They just want the antibiotics they think their dog has a urinary tract infection. And sometimes it is true. But also, I think it's time to scratch our head and be like, why is this dog getting chronic urinary tract infections? Have we damaged the immune system with antibiotics in the past? So there's a lot of pieces here that we can put the puzzle together and step back and look at it, rather than just using corner pieces, which is what we like to go to first. Let's look at the whole picture. Let's put it all together. Trust your gut when your dog's gut feels off. Absolutely trust it. It's okay to ask questions. It's okay to be like, hey, do we really need antibiotics for this? Hey, I'm happy to use them for my pet, my dog, or my cat. Do you think they're really needed right now, or are we just doing it to do something? And you can politely ask that and just make it a conversation. Or what you can say is, hey, let's say your veterinarian gives you both options. Let's say your dog has diarrhea and they're wanting to treat it with a stool firmer, a probiotic, and some formulated bland food. Great. Okay, I plan to do that. If I'm not seeing improvement by what day should we consider maybe changing the course? Maybe it's antibiotics, maybe it's not. Or your dog is coughing. Your dog goes to doggy daycare. And let's say you do chest x-rays and the lungs look clear and they don't look like there's pneumonia or anything concerning. Hey, can I have some cough suppressants? And by what day, if he's not better, what day should I consider doing antibiotics? Or what day should I consider like, are there any tests we can do? And there are tests we can do to help determine if your pet has an upper respiratory infection, what they are infected with. It's called a PCR respiratory panel. It's a little bit differently named lab to lab, but it is a great test and it can provide us really good information. Ask questions. Be proactive and an advocate for your pet. It is okay to ask questions. Now, I do think it's the tone in which we ask these questions. And some veterinarians are more open to questions than others. I think it's all about the delivery. Just like us as the veterinarians, it's all about our delivery to you guys for education. Ask the questions. Ask them. You should be able to ask these questions and be curious because you want to have a positive influence on your dog's health. And yes, we are there as medical professionals, we are there as the trained professionals, but also it is good when you are educated so that you can be empowered to make the best decisions for your pet. So if your pet, your dog has ever had antibiotics and you're seeing signs of gut imbalance or you're unsure, we can talk about it. You can book a one-on-one consult. If you love this episode, I welcome you to leave a review, send it to a pet parent who maybe leans on antibiotics a little too conveniently, or maybe they're anti-antibiotics. And so give them the perspective of both ways for them to consider both avenues. Hope you have a great one. I look forward to seeing you on the next episode.